As a man, surely at some point in your life you have looked for ways to increase your penis size. In fact, a large study published in the British Journal of Urology International, BJUI, of 26,000 men found that 45% wanted a larger penis, while only 38% wanted a taller penis. This suggests that the desire for penis size is stronger than height, one of the most valued physical traits. You might think that only really small guys worry, but research shows that most men who seek solutions fall within the normal range. For example, in one survey, when asked what is the normal length of a flaccid penis, men answered around 13 cm. In reality, the average length is only 8 to 10 cm. It is this discrepancy between perception and biological reality that makes many men feel self-conscious. It is no wonder that 91% of men admit that they have thought their penis was too short or too thin. So, what really motivates them? The most common reason is to improve self-esteem. Others want to change their appearance, increase their ability to please their partner, or simply feel more masculine. The problem is that many people tie their self-worth to the size of their genitals, which can lead to persistent insecurity. Some cases even fall into a medical condition called micropenis dystrophy, a form of body dysmorphic disorder. This is a serious psychological condition that causes men to believe that their penis is too small, even though it is completely within the normal size range. This causes stress, obsession, and seriously affects daily life and relationships. And because of this mentality, a lot of men have become easy prey for countless products and services advertised as being able to increase penis size, from pills, lozenges, creams, to cosmetic procedures that sound promising. But the question is, are they really effective, or are they just a trap that costs you money and even brings more danger? Don't be discouraged, because after exposing those potential risks, I will also share with you natural, safe, and completely free ways that you can apply right at home to make your little guy look healthier and more impressive. Potential dangers of methods on the market. I know in terms of data, the first thing you're going to ask me is, do these pills and gummies sold online actually work? And I'll say right away that there is no scientific data to prove that any of these pills and gummies can improve penis size. They are not FDA approved and often contain ingredients that are not on the label and can sometimes be dangerous. And just so you know, this natural male enhancement industry, in terms of the dietary supplement market, is really lucrative. It is estimated that it will be worth nearly $600 billion by 2025. A less invasive method is vacuum erection devices. They only temporarily enlarge the penis by drawing blood into the erectile tissue. Studies show that even when used for about 20 minutes, 3 times a week, there is no lasting change in size and user satisfaction is low. Meanwhile, penis extenders work like braces. They apply constant tension so that the tissue gradually adapts and grows. When used regularly for 4 to 6 hours a day, some studies have noted an increase in length but little improvement in girth. In other words, it may help increase length, but it definitely doesn't increase girth. Another less invasive method is injecting autologous fat into the penis. Doctors usually aspirate fat from the thigh or abdomen and inject it under the skin. In a small study of 88 men, they injected about 40 to 68 milliliters of this fat through a small incision near the glans. The result was an increase in penis size of about 2.6 centimeters, with the effect lasting about a year in 60 to 80% of patients. However, complications are not uncommon. Tumors, abnormal lipomas, skin disfigurement, scarring, and even more dangerous, death from fat embolism. So at this point, again, I do not recommend this method because I do not think it is the best option available and can cause quite serious complications. Next is silicone. It's used as an injectable liquid silicone. However, the body reacts to silicone. So what we see in these men is they get very severe swelling, they get deformities, they get what's called silicone granulomas, and they end up with sexual dysfunction as well. This happens up to 30 years after the injection. So again, I don't recommend silicone at this point because there's no safe way to do it. We often see fillers injected into the face and lips, but the most common is injections into the penis. Hyaluronic acid. When injected with about 20 ml, the length can increase from 7.5 centimeters to 11.3 cm. Generally, there are very few complications, except that patients complain of reduced sensation and erections that are not as firm as before because the hyaluronic acid is softer. However, this hyaluronic acid filler is not permanent and can lose volume over time. Another option is polymethyl methacrylate, a non-absorbable filler. It adds about an inch of girth and a little length because it is stiffer. But that's where the trouble begins. Nearly half of patients end up with lumps, dents, and dimples, and removing it is extremely difficult, with the risk of disfigurement, erectile dysfunction, pain during intercourse, and even fibrosis of the erectile tissue. What about surgery? Research shows that complication rates range from 8.6% to 100%, meaning that almost everyone experiences some problems. Common complications include swelling, scarring, ulcers, infection, and even skin necrosis that requires repeat surgery. The most common is a graft of inguinal tissue, which includes the dermis and subcutaneous fat. In 11 patients tested, they saw a 2.5 centimeter increase in circumference, but more than half experienced complications, swelling, painful erections, and temporary curvature of the penis. Another technique involves a saphenous vein graft used in heart surgery, which is sewn into penile tissue, reshaping the penis. In 39 cases, the penis increased in diameter by about 1.3 centimeters when erect, but did not change when flaccid. Nearly 40% of cases had a curved penis, although this usually disappeared within 3 months. In short, these are radical, extremely invasive surgeries with limited benefits and very high risks. Free home remedies to increase penis size. By the way, let me tell you that there is no pill, supplement, or cream that can make your penis bigger. So save your hard-earned money for something else. But there are some completely free ways that you can make your penis look bigger. First, trim or shave your pubic hair. Think of it this way. The base of your penis is hidden under your pubic hair. If the hair is too thick or bushy, it will cover up part of its actual length. Many studies on visual psychology have also shown that when pubic hair is neat, the penis feels 0.5 to 1 centimeter longer, even though its actual size has not changed. This is an extremely powerful optical illusion effect. Moreover, a clean and tidy private area not only makes you more confident, but also makes a good impression on your partner, because women often appreciate care, hygiene, and neatness in men. So, just a few minutes in front of the mirror and a trimmer or razor, you can significantly improve your image without spending a penny. Second, lose weight. Next time you stand in front of a mirror, try this simple thing. Press down on the layer of fat just above your penis, an area medically known as the upper pubic fat. You'll notice that part of your penis is hidden under this layer of fat. Erectile tissue actually extends deep into your pelvis, behind your pubic bone, and even down to your perineum. This means that you have more erectile tissue than meets the eye. But as you gain weight, especially around your lower abdomen and pubic area, this fat will cover part of your penis, making it appear significantly shorter. A study published in Journal of Urology has proven that every 10 kilos of excess weight can cause the penis to be covered by an average of 1 to 2 centimeters. This explains why many men after 30-40 years old, when their waists begin to expand, often complain that their penis seems shorter than when they were young. In fact, it does not shrink but is only covered by belly fat and pubic fat. And the good news is, this process is reversible. Urologists confirm that by losing just 5 to 10% of your body weight, especially belly fat, you can see a clear difference in penis length. In addition, losing weight also helps improve blood circulation, increase natural testosterone, and improve erectile ability. Although losing weight is not easy, this is one of the most sustainable and long-term ways to help your little guy look longer, healthier, and increase overall attractiveness in the eyes of your partner. Third, control anxiety. You may wonder, what does that mean? What does anxiety have to do with the length of my penis? Our penis is surrounded by smooth muscle, a type of muscle that is directly controlled by the hormone adrenaline, also known as the stress hormone. When you are anxious, stressed, or living in a state of prolonged stress, increased adrenaline levels will cause these smooth muscles to contract. As a result, the penis can temporarily shorten, even shrink completely inward, making you think it is smaller. In clinical practice, many urologists have recorded male patients with anxiety-induced penile retraction syndrome. They came to the doctor in a state of confusion because they felt their penis was sometimes long and sometimes short. But when explaining, the doctor said that it was just a physiological reaction when the body was stressed, and when the mind relaxed, everything would return to normal. A study by Harvard Medical School also showed that psychological stress not only affects the nervous and cardiovascular systems, but also reduces testosterone levels, the key hormone for male sexual function. This affects the length of the penis temporarily, negatively affecting desire and erection ability. The good news is that you can completely overcome this condition. Techniques such as meditation, deep breathing, yoga, regular exercise, or simply getting enough sleep. All of these help reduce stress, balance hormones, and relax smooth muscles. When the body is relaxed, the penis will return to its natural state, looking longer and fuller.
Fourth, maintain an erection. An erection is not only important for the obvious reason in bed, but it also has a very important medical role. It brings oxygen-rich blood to nourish the penile tissue. Every time you have an erection, millions of tiny blood vessels in the corpora cavernosa are filled with oxygen and nutrients, helping to maintain the elasticity and health of the tissue. This is also the reason why men often have involuntary erections at night or in the early morning. Doctors call this a phenomenon, nocturnal penile erection, a natural mechanism that helps maintain an erection, keeping the penis flexible. However, if this erection gradually decreases over a long period of time, the penile tissues can fall into a state of chronic hypoxia. At that time, they begin to lose elasticity, become susceptible to fibrosis, and even form scar tissue. The end result is that the penis can be permanently shortened. A clear evidence comes from a study of prostatectomy patients. Because the nerves that control erections are affected, many men lose the ability to maintain an erection. And after just 14 months of impotence, they can lose from 0.5 centimeter to 5 centimeter in penis length. This is an extremely alarming number. So if you find yourself having increasingly difficult erections, or not having erections strong enough, don't be subjective. It could be a warning sign of vascular health, endocrine health, or even cardiovascular disease. Be proactive and see a urologist for examination and treatment advice. Keeping your penis erect and healthy not only helps maintain its natural length, but also protects your overall health. And finally, if you want your little guy to look bigger and function better, start with the simplest things: lifestyle, diet, and daily exercise. In terms of nutrition, many studies have shown that zinc-rich foods such as oysters, clams, shrimp, and crab are not only good for vitality, but also help the body produce testosterone, the key hormone that determines the ability to have an erection. In addition, Nuts and beans such as pumpkin seeds, walnuts, almonds, or lentils contain L-arginine, an amino acid that helps dilate blood vessels and increase blood flow to the penis. Flavonoids-rich fruits such as oranges, blueberries, or strawberries are also worth adding to the menu because flavonoids help protect blood vessels and significantly reduce the risk of erectile dysfunction. When combined with a diet rich in green vegetables, whole grains, and low in saturated fat, you will keep the vascular system clear, ensuring good blood flow to the erectile tissue. Plus, sleep is incredibly important. Getting 7 to 8 hours of sleep a night helps your body produce more natural testosterone, while lack of sleep reduces male hormones and can lead to a decrease in sex drive. Smoking and alcohol are definitely enemies, as smoking constricts blood vessels and alcohol reduces the ability to get an erection, both of which weaken the penis over time. And you can't ignore the exercise factor. Cardio exercises like jogging, cycling, or swimming help your heart become stronger, improve blood circulation, thereby directly supporting the ability to get an erection. At the same time, Kegel exercises help strengthen the pelvic floor muscles, control ejaculation better, and maintain an erection longer. If you combine weight training or regular physical activity, testosterone will be naturally increased, helping you to be more energetic in both daily activities and sex life. Before you get too worried about whether you have enough little guy, let's take a look at some actual scientific numbers. The truth is that most men fall within a very safe range, much wider than you might think. Average circumference and length. When measured erect or when flaccid but still stretched, 90 to 95% of men fall within the completely normal range. A penis length of 10 to 16 centimeters, or about 10 to 16 centimeters. The global average length is determined to be about 13.2 centimeters, or a little over 12 centimeters. If you fall into this category, rest assured that you are in the majority. Medically, only extreme cases are defined differently. Micropenis when the erect or stretched length is less than 7.5 centimeter, equivalent to 3 inches, and big penis. A rare condition is typically longer than 24 centimeters, more than 9.5 inches. But remember, these numbers are outliers, representing a very small portion of the male population. There are also clear standards for girth, that is, thickness. When flaccid or stretched, most men measure between 8 and 10.5 centimeters, with an average of 9.5 centimeters, about 3.7 inches. When erect, the typical girth falls between 10 and 13 centimeters, with an average of 11.5 centimeters, about 4.5 inches. So when people talk about being average, these are the real numbers they're talking about. Unfortunately, many men compare themselves to the unrealistic standards they see, especially in adult films, where actors are cast solely for their unusual height. Even then, camera angles and editing exaggerate perceptions. The lesson here is simple. If you're in this range, you're in the majority. And even if you're outside the curve, that doesn't determine your health, attractiveness, or masculinity. To give you peace of mind that you are within the normal range, I will show you how to easily measure your penis length and girth at home so you can apply penis enhancement and growth strategies. First, how to measure length. Penile length can be measured in either an erect or flaccid state, and both methods have been used in scientific research. However, the most consistent and clinically reliable method is flaccid length, which correlates closely with erect length. To measure accurately, use a ruler or tape measure. Place it on your pubic bone, where your penis meets your body. You may need to press lightly through the fat to reach your pubic bone. Pull the penis out firmly, without force, and measure to the tip of the glands when the penis is deflated. The same procedure applies when the penis is erect. Start at the pubic bone and measure to the tip of the penis, holding the tape measure at the tip and in line with the shaft. It is important to avoid measuring from the skin or underneath, as this increases the length and can lead to an inaccurate measurement. Second, about the circumference, thickness measurement. The circumference is just as important as the length and can vary significantly from person to person. To measure, use a soft tape measure or even a piece of string. Wrap around the middle of the penis, not too close to the base or tip. Record the measurement at the junction. You can measure both a flaccid and an erect penis for comparison, but erect girth is the standard for most studies. Today, we've discussed scientifically proven methods for increasing penis size. And if you've ever felt anxious, know that you're not alone. Millions of men around the world are on the same journey. Don't hesitate. If you have any questions, leave a comment below, because your questions and experiences can be a valuable source of motivation and information for other men facing similar problems. I'm Dr. Laura. For over 25 years, I've dedicated my research and expertise to helping men and women over 60 regain their health and confidence. I'm here for you. If this message resonates with you, please share it with a friend or someone who needs to hear it. We all age, but we don't have to be silent or alone. And if this video helped you understand your body better, subscribe to my channel for more science and facts about men's sexual health. I'm here to help you stay healthy, fit, and confident.